Hi guys, welcome back to my channel MedMade Simply Easy. In this video, we're going to see about nephrotic syndrome. Epidemiology. It affects males more than females in the ratio 2:1. It is common in the age group 2 to 6 years. Although it can affect children of all ages and also adults. Usually there is a history of multiple relapses. And it is precipitated by upper respiratory tract infections. Pathophysiology. Glomerular injury leads to an increased glomerular permeability. Hence, there is a loss of proteins in urine. Clinical features. Nephrotic range proteinuria is seen, where more than 3.5 grams of proteins are lost per day. Now this is detected by 3 tests, which is early morning urine protein is 3 plus or 4 plus in urine dipstick test, or by 24-hour urine collection method. And the spot protein to creatinine ratio is more than 2. And the third test is urine albumin excretion is more than 40 milligram per meter square per hour. Now since protein is lost through the urine, there is less protein in the serum. So this is the hypoalbuminemia, where the serum albumin is less than 2.5 gram per deciliter, and it is due to proteinuria. Anasarca. Anasarca is due to the decrease in oncotic pressure, and periorbital puffiness is the earliest sign of nephrotic syndrome. Pitting edema is seen up to the knees. Anasarca, or the generalized edema, it also includes the pedal edema, ascites, scrotal or vulval edema. Now since proteins are lost in the urine and there is less protein in serum, liver tries to compensate this protein loss by increasing the production of lipoprotein and lipid. So this increases the serum cholesterol levels and serum triglyceride levels. And hence we have hyperlipidemia, in which the serum cholesterol is more than 200 milligram per deciliter. Now the other features in nephrotic syndrome is there is a decreased urine output, but the blood pressure is normal, and if it is associated with abdominal pain, vomiting and diarrhea, then this could indicate bacterial peritonitis. If there is dullness at the base of lung, it indicates it is secondary to pleural effusion. Now there are 4 clinical types of nephrotic syndrome. Steroid resistant nephrotic syndrome, steroid sensitive, frequent relapses and steroid dependence. Now in steroid resistant nephrotic syndrome, it is due to the absence of remission after 4 weeks of daily prednisolone 2 mg per kg per day. Now remission means when there is no signs and symptoms of the disease. Now for the steroid sensitive nephrotic syndrome, there is remission within 4 weeks of daily prednisolone therapy. Now in frequent relapses, there are 2 criteria. The first is if there is more than equal to 2 relapses in the last 6 months, or if there is more than equal to 3 relapses in the last 1 year. Now for steroid dependence, the criteria is more than equal to 2 relapses on alternate day steroid therapy or within 14 days of stopping steroids. Pathological causes of nephrotic syndrome, or the pathological types of nephrotic syndrome, are minimal change disease, focal segmental glomerulosclerosis, membranoproliferative glomerulonephritis, membranous glomerulonephritis. Genetic cause. The genetic cause of nephrotic syndrome is congenital nephrotic syndrome, which can be diagnosed at birth or within 3 months of birth. The secondary causes of nephrotic syndrome are due to infections, vasculitis, drugs, malignancy and other causes. So in infections, the secondary causes are congenital syphilis, toxoplasmosis, CMV, rubella, hepatitis B and hepatitis C, HIV and malaria. In vasculitis, the secondary causes are vaginal granulomatosis, polyarteritis nodosa and microscopic polyangiitis. The drugs that can also cause nephrotic syndrome are penicillamine, NSAIDs, mercury, and lithium. And the malignancy causes are lymphoma and leukemia. The other causes are diabetes, lupus nephritis, and amyloidosis. Pathogenesis. Now, when there is decrease in serum albumin, the plasma oncotic pressure decreases. So this causes the fluid from capillary bed to move into the interstitial space. So this causes the circulating blood volume to decrease, and this decrease in blood volume stimulates the RAS system, which is the renin-angiotensin and aldosterone system. When the RAS gets activated, there is retention of sodium in distal tubule, and this causes edema. Investigations. Urine albumin, spot protein to creatinine ratio, serum albumin level, serum cholesterol, RFT. Usually normal serum creatinine levels are seen. Serum calcium levels. If infection is there, urine culture and blood culture is also done. Serum C3 levels, renal biopsy, and before starting steroids, baseline BP, eye examination, chest x-ray, and Mantoux test is done. Management. High protein diet with no added salt is recommended. Prednisolone is the recommended drug in nephrotic syndrome. So the first 6 weeks, 2 mg per kg per day is given. So up to 60 milligrams can be given per day. And this is a daily, prednisolone is given daily for the first 6 weeks. And for the next 6 weeks, 1.5 milligram per kg per day is the dose, and up to 40 milligram can be given on alternate days. And diuretics such as furosemide or spironolactone can be added for edema. Treatment of frequent relapses. So if a patient has frequent relapses, corticosteroid is usually contraindicated due to the toxicity that can be developed due to prolonged corticosteroid therapy. Now, immunomodulatory drugs are given, which are steroid-sparing agents, such as levomazole, oral cyclophosphamide, tacrolimus, and mycophenolate. Immunization. Inactivated and killed vaccines are safe. Usually, nephrotic syndrome patients are considered immunocompromised. That is why live attenuated vaccines are contraindicated. Pneumococcal vaccine should be given for all nephrotic syndrome patients during remission. And a pneumococcal vaccine is given against pneumococcal peritonitis and sepsis. Now, if the nephrotic syndrome patient is Mantoux positive, but there are no tuberculosis symptoms, then isoniazid prophylaxis can be given for 6 months. Thanks for watching, and subscribe for more such videos. Check the Pediatrics playlist for other videos. And also let me know your suggestions in the comment box below.